This month, the CDC signed off on a new shot for RSV in infants. Nirsevimab is an antibody shot meant to protect against severe RSV, a virus that attacks the lungs. The FDA approved it for newborns last month.
This morning, our 9 News medical expert, Dr. Kohli, joins us to talk a little bit more about this decision. Good morning, Dr. Kohli.
Good morning.
Well, so first of all, what is RSV and why is this new announcement such a big deal?
So respiratory syncytial virus, it's a foe that we've been fighting for many years. And for most of us, it's just a cold that lasts about a week, sometimes up to 2 weeks. But at the extremes of age, so we're talking infants and young kids, as well as the elderly over the age of 60, it's the leading cause of hospitalizations, and it claims about 300 babies a year.
Who's eligible for the shot?
So that's kind of interesting because the way you mentioned it, the shot is antibodies. It's not a vaccine. And so if you think about the small babies, their immune system is very immature. So if we give them a vaccine, they're not really able to make those types of antibodies until it starts to be a bit more mature. So this shot is really designed for those little babies in the first couple of years of life. So if you're under the age of 9 months, this is your first RSV season going in, or if you're in your second RSV season under the age of 19 months, but a little bit higher risk, that's who would get this injection.
All right, so the CDC director called this a really important step, saying that she hopes that this prevents tens of thousands of hospitalizations every year that you were mentioning. A lot of parents at home wondering, okay, but what's the catch here? Is this going to come with a pretty high price tag? Do we know anything about that yet?
It's a pretty high price tag, so it's about $500 per shot. But if you think about it, that one shot is going to last you through the entire season.
And what's a hospital visit, right?
That's exactly right. And it reduces the chance of you needing medical care as a little infant by 70 to 75%. Wow. So those antibodies are really supposed to last for several months. Now, what we had been doing in the past was actually vaccinating mom late in her pregnancy so that she could make antibodies and transmit them to baby through the placenta or through the breast milk. But that's not turning out to be as effective a strategy. So I think this is actually really going to be a big game changer when it comes to kids. And the CDC is now classifying it as a vaccine so that it can even be, allowed to given to the uninsured kids without an additional cost to their parents. And that's a big deal as well,
big.
Because technically it's not a vaccine.
Yeah. Aside from the price tag, what other things should parents know before going in?
So, anytime you give any kind of an injection, there's a risk of side effects. This is an antibody injection, so it can activate the immune system. So some kids can have a little fever, they can get a little rash, they can obviously have a problem where the injection was actually given. In the very rare cases, there's a warning for what's called anaphylaxis, a severe allergic reaction, because it can kind of tickle the immune system in a funny way, but really, really well tolerated, and most kids actually have no problems at all. The access is the other issue that I'm particularly concerned about. We're talking about this a lot, but is it really going to be readily available in the clinics, in the offices, where parents can actually get access to it? Because unless we roll it out on a population level, if only a few kids get it, it's not really going to be that effective. In fact, you need to treat 56 babies in order to prevent one hospitalization. That's something called the number needed to treat. That's not that high when it comes to some of the other medications that we use.
We have just a few seconds left, but I want to ask what's next in this. The CDC signed off on this. What more has to happen before we see this roll out?
So now we really need to increase the manufacture, and we need to get it out into the clinics, into the pharmacies, into the offices. And this is a really great strategy to protect our babies. I would say for adults over 60, this is the first year we also have a vaccine. So that is also important. If you're an adult over the age of 60, go talk to your doctor because you are going to be eligible for that RSV vaccine that was approved earlier this year.
Yeah, very interesting. Dr. Kohli, thanks for coming in.